On today's Martin Minute, we're talking with Dr. Eric Rustemeyer about dental implants. So why would you get that? Is that a more permanent fixture than going with dentures?
They absolutely can be, especially if you go with a solution where you're having implants placed and a bridge made for them. Depending on what the final material is made out of, frequently you'd never have to make another restoration in your life. Whereas if you get dentures, they frequently have to be adjusted over time. They have to be relined as there's bone resorption that occurs underneath the dentures over time and they start to fit poorly. So if you want something that's going to have the minimal amount of maintenance, definitely dental implants are the best permanent option.
So how do we find out if we qualify for this procedure?
By doing a consultation. We provide free consultations where we have the patient come in, we review their medical history, make sure that they don't have any problems that will prevent them from getting implants, and then we take a 3D x-ray to look at the bone.
If I was considering getting full dentures, is this a better option?
I would definitely say it's a better option, especially going the route where you get bridges, because then we don't have to do any maintenance on them in the long run, or at least the maintenance is significantly reduced. If you're looking at getting dentures top and bottom, the standard of care, at least for the lower jaw, is to get at least 2 implants placed and having a denture made that snaps onto them. Because otherwise, there's really nothing that's going to stabilize that lower denture, and you'll probably be miserable having it.
And it can affect your facial structure as well.
It absolutely can. If you have dentures over a long period of time, there's bone resorption that occurs when you're chewing and biting with those dentures and putting pressure on the bone as a result of that. So the bone tends to shrink over time, and you can literally see it change the way people's faces look.
I'm assuming that chewing food is a big part of your choice on what you get from this.
Yeah, it absolutely is, because it's basically what's going to determine whether or not you can chew regularly or have to deal with dentures, dentures are basically mouth wigs. I mean, you can't really chew with them very well. They don't function like natural teeth at all. And the best case scenario, if you have dentures top and bottom, is maybe being able to grind side to side and chew. If you're trying to actually bite into something like an apple, or if you're trying to chew anything that's tougher like a steak, especially a well-done steak, it's just not going to happen. So the best route to go is getting implants and then having bridges made that screw onto the implants and are fixated in place. There's nothing that we can do yet that comes closer to having natural teeth in that solution.
So why should I come to Martin Dentistry as opposed to going to one of the many places down the street?
Well, the advantage of Martin Dentistry is that we provide an A to Z service for the dental implants. We work the patient up, we plan the surgery, perform the surgery, which includes any bone grafting that may need to be done, soft tissue grafting, and then of course placing the implants. And then we put the teeth on them. Your average office, you have general dentists that will send the patient to a specialist. They will plan the surgery and place the implant, and then send the patient back to the general dentist who puts the teeth on. Sometimes there's discrepancies between where the implant gets placed and where it needed to be placed. It can make it more difficult to put the teeth on. Here at Martin Dentistry, we don't have that problem because we take care of everything A to Z. And that includes anything involving a single tooth, multiple teeth, you name it.
For more information, give them a call or visit martindentistry.net.